question previously, well, why do we even need a medical program now that we have, all adult Vermonters have access to a regulated market? And I can tell you that the medical program fills a very critical role that the adult use does not. I mean, the very kind of foundation of it is privacy. There's lots of regulated professions that, the stigma of cannabis use is still very real. And there's a lot of regulated professions out there, or unregulated professions, that you just can't be known as a consumer. My neighbor just had a herniated disc and had a back surgery. He's got a CDL. He's been on opiates for 6 weeks, waiting for a surgery, and he's going to be on opiates for another 6 weeks after the surgery. And he wants to use cannabis. He's on leave, but if he goes into the Capitol Cannabis and one of his supervisors sees them, they're going to be like, "Well, you can't have your CDL," or teachers, doctors. There's the same situation. So privacy is really important. There's some gaps between the medical system and the adult use system. There's products that are probably not profitable on the adult use system, very high CBD, very low THC. So very low psychoactive, very high kind of pain relief that just don't really have a profit incentive on the adult use side. These are all for-profit companies. There's delivery, there's access to caregivers if you can't take care of yourself. You can be under 18 and get a medical card if you have certain qualifying conditions. And of course, you can purchase tax-free, and that's been helpful to lower income Vermonters. So there's a very real need for the medical program, and I will tell you that it's in very serious trouble. Patients have been declining rapidly already because of the kind of structure, the way that it was structured. There's only 5 medical dispensaries across the state, so almost no one has access to them. Because there was only 5, and, prices were, the economies of scale are low, prices were very high. I would say that everything that's in section 13 of H270 are stopgap measures to protect patients while we come up with a more structural fix to the medical program. And because I don't see these kind of structural deficits going away without some legislative action. With respect to the first instance of amendment changing, I think it's really important to remember what's going on when someone renews a medical card, because doctors are not prescribing. They're not. Up until recently, they're not allowed to prescribe cannabis. They're not allowed to recommend its use. Medical schools don't talk about cannabis a lot. They don't talk about any. I think the consensus opinion amongst the medical community is that there are no therapeutic uses beyond maybe quality of life improvement to cannabis. And that's just a direct result of the lack of this being or research. I think it's really important to understand that doctors, healthcare providers are not prescribing or recommending cannabis use. They are merely certifying that one of their patients, someone in their care, has a qualifying condition. And all of the conditions that qualify you to get a medical card, with the exception of chronic pain, which can be lifelong, but is just defined in the DSM-5 as 3 months or longer, are lifelong conditions. MS, HIV, all of the Parkinson's, all the qualifying conditions. And so to have a doctor have to certify year after year after year that this patient continues to have this condition is not only a waste of medical resources, it's staff intensive on our side. It leads to delays in issuing medical cards because we have to chase down that doctor and verify that they did sign this form. It's a big paperwork exercise that really serves no benefit to the program. The kind of, just for us to say, yes, this patient continues to have HIV in 2021 and 2022 and 2023 is really, it's just pushing paper. And, this a medical card could be permanent because these conditions are permanent. And that's the only qualification, but we thought 5 years would be a nice way for us to check in, with the patient.
Would you go for 2 or 3?
Of course, and yes, it's a policy decision for this committee, of course.
I would negotiate, pick your choice, 2 or 3.
Yeah.
Well, but here's my thinking, that everyone should be going to their physician at least once a year. And folks with some of these chronic conditions are seeing docs all the time.
Right.
So it's not like brain science there, but then the question is the complexity of getting the card and then registering with you. So it seems to me, that's why I put in the language that's in here. So for looking at the protocol that's involved. So if we were to move it to a 2 or 3 year period check-in, but then knowing that there are some conditions that are currently listed that may well resolve themselves one way or another, it does make sense to ensure that folks have some connection with their provider, whether it's a psychologist, a psychiatrist, or a primary care doc or a specialist. It's just, for us in here, it's just primary to do that.
And I think your point is right. These people are going to continue to see their doctor. It's really just, do I need to remember on the expiration date of my card to have this form for the healthcare provider to sign? And then for the board to then call the doctor and make sure, did you actually sign this or is this forged? It's just, it turns into, I mean, it's just staff intensive. It's cumbersome for the patient.
It can't be by email, I guess.
It can be.
It could be.
It could be, but
that's the whole thing about, having the discussion between now and next January. Are you okay with that language, I guess?
So,
First, let's confirm, 2 years or 3 years?
I mean, our original proposal is 5, so I think 3 would be more appropriate, but again, this is purely a policy decision.
Yeah.
I don't want to just kind of put my finger on the scale.
Okay. So I'm looking at the committee.
I could go with 3. I could live with 3.
All right, Michelle will go with 3.
Yeah.
All right. But we want to get some,
Right.
yeah. Okay, go ahead.
So with respect to the next one, I just want, so this bill, when it was introduced, added 13 qualifying conditions. And
I know.
the reason why it had those 13 is because I serve on a group called CAMRA, it's the Cannabis Regulators Association. It's just everyone around the country that's sitting on the cannabis boards in their various states, and some of them are in the Department of Health, some of them are in the Agency of Agriculture, some of them are standalone boards. And they just talk about emerging issues and they form subcommittees. I'm on the medical use subcommittee because I know that our program is in serious trouble. And I wanted to just kind of get a national perspective about how other states handle things like qualifying conditions. And so the chair of that committee is his name is David Rack. He's the head of the medical program for Minnesota. And he said, well, Minnesota and a few other states have a petition-based process. So once a person gets 500 signatures or however many signatures for, adding a condition, whether it's autism or, anxiety or something along those lines, then they have 3 researchers, PhDs, that grab all of the clinical trials, preclinical trials, behavioral trials, or studies that exist. And again, not a lot of them in the United States, but there's certainly a lot going on internationally about that condition. They break it down into what symptoms, define that condition. And then they look to see if cannabis use has been effective in treating any of those symptoms. And then they present that to the board and the Commissioner of Health in Minnesota. And then they take a vote on whether they should include it or not. And they've voted against things like anxiety. They voted against a number of things. But the condition, with that list of 13 conditions that I recommended adding, just would square us up with Minnesota, which is also a very restricted medical program. But there are white papers detailing the scientific literature around each one of those conditions.
So I hear all that, and I think that's terrific and it's really good. But what we need in this state is presence and and the information. So what we're asking, or at least my perspective on putting this in here is to begin to bring that into the conversation. So there, and to understand what is being recommended based on the scientific literature and including, I don't have Department of Health in here, but they serve on the academic detailing program and do a good job of looking at, they've actually gone out and detailed and docs on cannabis. So I have to sit on that board. We meet once a year. But I think it's now a nexus that we need to have in this state. I'm not suggesting that any of the work that's been done by the board or the list that's out there is inappropriate, but it's really to have it become part of the Vermont medical cannabis process. So there might be some recommendations that are brought to us that would change the way things happen. So it might become more like Minnesota.
Right, and frankly, I just didn't think we had the resources to mimic what Minnesota was doing. So I just decided we should just piggyback on the work that they've already done.
Well, we might decide that, and that's a recommendation that you can bring to us. And it's something that in working with our medical folks, right now, we have a couple of senators working with the dean of the medical school and medical students on psilocybin. And so I can see an interest growing there for drugs that we currently have in the state that are getting up.
So I agree. I think I would prefer it to be in state, because I think where things fell apart on the qualifying conditions list in the House was the Department of Health and didn't have the time to review all of the research. Right.
Exactly.
Right. And I think that's my fault for not getting the research earlier, but also they're also incredibly difficult.
So sitting down with folks, I'm not suggesting that you're doing anything wrong. I agree with you about the medical cannabis program. I think it's something that we can reinforce and make more prevalent, and just through public education, but also at the other end, knowing what the information is, the data informed process. If it's only at the board and it's not out in the broader medical or patient community, we won't see the improvements.
No, I appreciate everything that's in here, and I do want to bring in the Vermont stakeholders. That was my, I thought,
Good.
as in the stopgap, let's, in this kind of like, while we're not thinking about kind of big structural changes to the program, let's bring in the conditions that have been vetted. But, I understand the hesitancy to do that without getting the Vermont professionals.
I'm not suggesting that we take out those 13 conditions.
Right.
It's not in, Michelle, correct me if I'm wrong, that's not in our amendment to take out those 13.
They were removed in the House.
Yeah. But so then this is an opportunity.
Right, no, it is.
This is a huge opportunity.
Right. I think my, and I know that this was drafted quickly, my only concern with this is that the medical organization stakeholders, I think that leaves out a lot of the patients and caregivers when you're thinking about.
Who do you want to add in? This is a draft.
Yeah, no, I just think it should be relevant stakeholders, not medical organizations.
Well, relevant stakeholders, including medical and patient. Something.
Yeah.
Relevant medical and patient stakeholders. How's that?
It's anything
Michelle,
along those lines, because we're gonna do this work anyway. We
Good.
absolutely need to do this work.
Good.
I'm not, I just don't want to have some people sitting on the sidelines that have lived experience.
And other
with this.
interested parties.
Right. And
Relevant medical and patient stakeholders and other interested parties. There, how's that? We don't want to exclude anyone either. We're not inviting the House or the Senate to be sitting on this. Do you want to do that?
No, I think Senator Williams is.
Senator Williams is ready? Okay. No, I think we're in agreement.
Yes, no,
Yeah.
we are.
Yeah,
Yeah. The question is 5, like no less than 5 times?
yeah, what is that? What do we say there?
I just don't know, I just don't know. Is like, are we gonna be able to get the academic detailing program to meet with us 5 times. I don't know.
You might, yeah, so, how many times do you think will be sufficient? I want the work to be done by the group, that's the real issue, so.
I don't know, it says no less than 5, and I just, you know, this
What
work has to
seems
be,
realistic?
I mean, when's the drafting deadline for next year? Is it in December?
Yeah.
I worry about just having to have a statutory thing 5 times and having that derail the work products.
4 sufficient? I mean, how many times do you need to meet to do this? There's a lot of work embedded in here.
There
It's
is.
no
Yeah.
less than, so you can meet more, but just no less than, right?
No less than 4. I go for that.
No less than
Quarterly.
4. And I also just wonder if, I mean, I think for some of this stuff, the answer is gonna be, we just don't know.
Well, that's what happens.
Because the dosing of
Yeah.
chemicals is really based upon any number of factors we don't fully understand yet
Yeah.
about the endocannabinoid system. So,
I'm with you.
yeah,
We got it. We know. This
Okay.
is there's a lot of unknown
right,
things out there.
right. And I think this might lead to, what do you call it? Divided report, you know, just like the
Yeah.
sentencing commission very often has divided
Right.
report about, you know, whether you should remove cash bail and things like that.
Well, there will be things that are left undone and that you are going to continue to explore. This is just getting it all
Yeah,
started.
I think there'll be a lot of non-consensus opinions about,
Cool.
almost all of these things.
Okay.
Yeah.
Well, then that opens up an opportunity for your bringing in some of the research that you are doing out there with Minnesota and others.
Great. Okay,
Okay, thank you.
thank
I
you.
know, we're pushing it a little bit, but I think from our perspective, it is having all of this be a part of the medical marijuana program to improve that program to have it become a standout program. And it has become that, it has been over time. The board has worked so hard on the other side of it now. I feel that for us in our committees, important to get a hold of what's going on medically.
That's great. I really, again, appreciate the time you've spent on this because of everything else you have going on. You know, medical cannabis doesn't always feel like it is in the spotlight or should be in the spotlight, but I think it does provide a very critical role.
Well, for the people who use it, it is really important. We understand that. Okay.
Okay,
Great.
thank you.
We're good?
The changes that I heard
Okay.
were in the first instance of amendment, rather than striking out that section, changing the 5 years to 3 years.
Yes,
Expanding the language around stakeholders that are to be a part of the study.
yeah,
And then changing the language in subsection B to be not less than 4 times
okay.
meeting.
I do have another question. Do you want to say, we don't need to say anything about utilizing what's happening in other states. You're already on that.
I think that'll be the basis of
Yeah.
our conversation.
Jill, did you want to make a quick comment?
Super quick.
Good.
Jill Sudhoff Aaron for the Vermont Medical Society, and we think this is a good call. I think it's almost 2 decades of having the registry, and I think just with the recreational program, there needs to be a real look at what the dispensaries in the medical program do and how they differ from the recreational market. And I think having the evidence is good for everyone, specifically good for the patients of Vermont and good for the medical community so they can be clear. And as you know, we haven't always been supportive. We've been known as more the prohibitionists, but I think something like this helps educate everyone and really brings all the evidence to the table. And I think we appreciate it. I just wanted to clarify, so you are you keeping that section in there about removing the mental health professional for PTSD, or are you waiting?
And
on
we're
that?
gonna leave it out as it was in the bill for now. We'll hear recommendations. I think bringing folks together and then allowing for us to understand what are the treatment modalities most important when marijuana is included. That's something that's outside of this room. And so it's professional activity. So this is an evolving area, and we've heard different things from different people. So I think we'll leave it out. We'll just leave it as it is right now. They've struck that.
Okay.
Yeah.
Okay.
At least that's my opinion.
Thank you.
Thank you. So Michelle,
I'm gonna go try to make these changes, incorporate them into the mental health and welfare amendment. I won't have any time to have it edited or anything like that, but you're just presenting next door. And Scott did email me because they're working on other cannabis amendments right now in economic development that are coming from Senate.
So
They're
what
running
do-
a little behind. I don't know if we're still on for 10:45 or not.
They're running about 10 minutes late.
Oh, great.
So I can go incorporate these changes and then I'll send something back to you and join you either here or most likely in economic development as soon as I can.
okay, so what we had yesterday,
I don't think you asked me, you asked for any changes.
we haven't asked for any changes on yesterday's.
I don't recall
No.
any.
And we're adding in what we just talked about today,
Yes,
and then we'll have one amendment.
correct.
And I'm going into economic development 10 minutes late, so at 10:55 to talk about this, so
Okay.
we're good.
Or just as well as I can.
Thank you all. I really appreciate your taking the time, and the work that you're doing is terrific. Yeah, it's great. We just want everybody to know about it. Good.
Thank you.
Did I miss? I'm sorry.
You missed one, and I'll get
Oh,
you now,
oh.
the psychology compact.
Oh, I should vote on that. Since
Yeah,
that's the bill
you're
I'm
the
reporting.
reporter.
Oh, wait, before we go there, everybody's okay with the proposal amendment that we just did for 270?
Definitely.
So the getting the folks together with the medical cannabis program and the board and the medical folks and the patients and coming back with recommendations on improving the protocols and others, all that, okay. And then the proposal amendment that we had yesterday, are we okay with that? Just raise your hand and say yes or no.
Sure.
So that-
Yes.
yes, I'm sorry.
You're okay with the proposal amendment on the, yeah, okay, we're good. That's all. I want to say supportive of the committee. Thank you. And thank you, Jill. We're all good.
So Ruth, can I put you down as a yes vote on the side pact? Yeah,
Yes.
wonderful.
The other thing, Senator Hardy,
Yeah, go
we did a couple nominations while you were out,
Oh,
for governor's nominations. for local boards and such.
okay.
Probably another opportunity next week.
Okay. I have a bunch to present to you if you want to do that.
ahead. Do it.
I did my.
My question was, were we going to vote on Jenny Samuelson and who was the other one today?
Chris Winters.
Chris Winters? Do we have their CVs?
We
That was
do.
keeping us from doing
We do. I forwarded them to everyone a little while ago. I'll resend them now.
it. Can we get a print?
Yes.
One, go give it.
So,
Oh, yeah, sorry, Melissa. Is Melissa the person that we're gonna give these to?
No.
Yeah, yes,
Close enough.
Good.
yes.
Oh,
And I have something I need you to sign as
Since you're
well.
here.
Yes,
okay.
thank you.
Thank you.
Thank you.
She's gathering signatures.
And everything done for the weekend.
Are we off are we off?
No,
We
you're
are
on.
live.
Okay.
Real life.
So if we do some board, we do Senator Hardy's board
Okay, I
nominations.
just wanted to ask if that was a home use for me. Thank you.
Okay, you have, go ahead, Senator Richard.
So Senator Hardy, are there specific nominees that you want?
I have
to-
a few, yes. I have, so one, I was given 5, plus I have one more that I haven't had a chance to contact, but I think I emailed you, Senator Weeks, and Alex as well, about Sarah McLean. She was reappointed to the Board of Medical Practice in error.
Correct.
She's already served her maximum number of terms. Okay,
Yeah,
so,
her nomination, she went back up to Secretary's office, go back to the governor's office to find a new candidate.
okay, excellent. And then Mike McShane was appointed to the Board of Health, and I had a conversation with him and would recommend that he be approved. However, there is a bill in the Senate Government Operations Committee to eliminate the Board of Health. So, and we've taken testimony and everybody's in agreement to do it. So I'm not sure what we want to
Well,
do with this appointment.
We've set a little precedent this morning. Senator Lyons had a similar, had the chair,
Philibert,
Right.
yeah.
Yeah.
We had her in yesterday.
So,
and
but
she was
we-
like,
Oh.
yeah,
but we moved forward, we voted on it.
okay.
And then we passed the sheet back to the Secretary's office.
Okay, and then Dr. Christine Payne from the Board of Medical Practice, I had a conversation with her and I would recommend her approval as well. Katie Aiken for the Human Services Board, I had a long conversation with her. She's wonderful and we had a great, just a really comprehensive, wonderful conversation. She does amazing things for her community and she would be a wonderful witness on a whole bunch of topics.
Oh, good, right?
Yeah, she's from Bennington,
Okay.
and she's wonderful. And then Linda Johnson from the for the Children and Family Council for Prevention Programs. She served on that board for a long time and
She's the head of prevent child
abuse. Yeah, so I recommend all of, so those 4, McShane, Payne, Aiken, and Johnson, as recommend for approval. I spoke with all of them.
Is that a motion?
That is a motion.
I'll second. All those in favor, say aye.
Aye.
And then just to make sure we're on the same page, you had a Matt Wolf under Child and Family Council Prevention, but there was a duplicate entry. I gave you the paper early on, but that's a duplicate entry. I contacted him. We voted this morning. He's approved.
Oh, okay. I don't remember if I even had, and then I had another one later on that Alex sent me, and I can't remember who it is. It's very,
That was the map.
that was Matt Wolf. So am I done?
You're done.
Oh, awesome. Thank you.
See how good that feels?
That
So
does feel-
I'll update this. I'll give it to you next Tuesday or before Tuesday.
Okay, and I will.
We
You
have,
want, I can actually do Richard Kloppenberg,
okay,
doctor,
What?
Dr. Richard Kloppen for the health and,
Yeah.
medical,
Board of Medical Practice.
correct. And he's already served part of his term. He's still on the board, and the guy's been doing this, he's been practicing medicine in Perkinsville, Ludlow area, for 30 years. So I can recommend him. I've asked him to send me a bio sketch, and haven't got it yet. Same thing with
yeah.
Stephanie Lawrence. But because he's already serving term, he is attending meetings. I think I can recommend him for,
And he's interested.
he is interested, yes. He had a few complaints, but
Everybody's.
it's not a perfect system, he said. But
Yeah,
Can you do another development?
yes. Okay, so
So I'm motion
Is that a motion?
it's a motion, yes.
Second.
So,
Thank you.
All those in favor, please say aye.
we have 2 more. We have Chris Winters nominated as Commissioner of Department of Children and Families. We've got the bio here. And also Jenny Samuelson was Secretary of the Agency of Human Services. we have the bio, we've actually had interviews for both of them, so I would accept a motion for either or both, one at a time.
So moved,
For-
either or both or one at
Which
a
one would you
time.
like to move?
Secretary Samuelson.
Okay, I'll second that. Is there discussion?
Thank you.
Okay. Clerk,
All those in favor, please
we
say
should
aye.
probably do a roll call on this.
Okay. Um, So no discussion on the confirmation of Jenny Samuelson? Okay,
So,
I need a roll call
Yes.
sheet.
there you go. This is for Secretary Samuelson and Commissioner Winters.
Thank you very much.
There's one for each of them.
Remember, she was deputy secretary until 2020. She's been, she was appointed as secretary in 2022. And she served as, in the Department of Vermont Health Access. And I've been communicating with her about, and others regarding progress on Act 167, which is the big step forward on our healthcare reform. And she's taken some strong leadership in that area, both in AHS and between AHS and Vermont Care Board, working collaboratively with those folks, just to remind ourselves about who she is and what she's doing.
Who's going to be the reporter on this one?
I'm happy to do it.
Okay, so voting on the, taking the confirmation of Jenny Samuelson, who's Secretary of the Agency of Human Services, to the full Senate. Senator Gulick, yes. Senator Hardy,
Yes.
Senator Williams,
Yes.
Chair, Vice Chair Weeks.
Yes.
And Chair Lyons.
Yes.
Vote is 5-0-0 in committee.
Now we have, someone want to make a motion on Chris Winters?
I'll make a motion to bring the confirmation of Christopher Winters to Commissioner of the Department for Children and Families to the full Senate.
I'll second.
Thank you. And roll call vote, Senator Gulick, yes. Senator Hardy.
Yes.
Senator Williams.
Yes.
Vice Chair Weeks
Yes.
and Chair Lyons.
Yes.
The vote is 5-0-0 in committee. I would be happy to report that if no one else is super excited to do it, or,
That's fine.
okay.
Do we have,
I think I have one more coming.
do we have a sheet?
These go to the governor's office?
They come from the governor's office, and we take them up
The Senate?
to sign it, put the date and the vote, and take it up to the secretary's office.
Good.
You have one more?
I think I should have one more paper. I don't know if you have it.
What's the name?
I have to look again. I was just looking at the number. So I have. Katie Aiken for the Human Services Board. She was the foster parent of the year, and and she's just done so many wonderful things. I was super impressed. We had a really long conversation. She's wonderful.
So you're recommending?
Yeah, we already voted on her, but
Yeah.
it was one of those really just lovely conversations
It's
with
nice,
somebody who's
right?
doing really great work in her corner of the state, and it
Where's
was
she
nice.
from?
The Bennington
Bennington, oh,
area.
she's a Bennington.
Yeah,
Nice.
got her.
You have senator?
Yeah, it'd be nice. Oh,
Alright.
yeah. I don't know. I didn't ask her. Governor.
So, you know what, we've really done a lot this week, and I greatly appreciate all your efforts, inside and outside of committee. And so next week, we have we'll have another full agenda. We've left some time on Tuesday for discussion, we might add something in if we see any proposals of, any proposals that come our way on any of our bills, we'll take them up as they get to us. But our goal is to look at 206, 481, 414, and possibly 94 next week. And they're all the bills we've been through, and some are less complicated than others. So I think that we've finished for the day. It's a wrap. Thank you.
Senator Hardy, don't leave yet.